All told, this is kind of a long way of saying, from my aspect, when I talk to a patient, I need to figure out as accurately as I can what is the complete picture, what's really wrong. It's not just often one thing or another, it's a conglomerate. And as a surgeon, if I set out to fix something, if I think that's a reasonable option and a recommendation that you can consider, I try to think of a whole global picture to at the end, give not just good relief in the short term, but in the long term. When you go to see a doctor and you say, my back hurts, my leg hurts, my buttock area, which is sciatica, hurts. You get an MRI if you don't get better with normal conservative treatment. Getting that information as accurately as possible means you're going to get the best treatment recommendations as possible. And is, by the way, the most cost-effective way. You don't waste time doing other things. So your MRI, that becomes a real key to this whole deal. Now, if your back hurts laying down just the same as it does being up, putting weight through it, I think any MRI is likely to be as accurate. At least that makes sense to me. However, if you hurt worse when you're upright, standing, sitting, lifting, bending, twisting, then you ought to consider getting an MRI, because your doctor wants to know what's the worst thing. What do you look like in the worst position, not what do you look like in the best possible position. So if you have an MRI lying down with no weight on your spine versus standing up or sitting and putting your weight through, it changes. At least it changes sometimes. And when it does, the upright MRI is going to pick this up. That's exactly what the upright magnet was designed to do. Now, if you think about it, what if instead you get an MRI this direction and it misses the problem? Then how does that conversation go? Well, I'm not sure what's wrong with you. We can keep trying this, we can try that. And if it doesn't work, because you've got a real problem, remember, there's really a problem there. It just wasn't picked up. Finally, you get around to a conversation with your physician. Well, some people just hurt anyway. Who knows? Are you kind of emotional with this sort of thing? Are you looking for medication? And you know, there's a lot of good people out there that have a real problem. Take it even further. So your lie-down MRI shows part of the problem, and you wind up in surgery. Now, how is your surgeon supposed to really figure out his surgical plan when he doesn't have the most up-to-date and accurate information? So if you do have surgery and the results are great, fantastic. If they're not great, you know, I tend to wonder, at least for my own practice, which is why I helped bring this technology to town, to the state, and the reason I utilize this technology is I want to be as accurate as I possibly can. Getting good results for back surgery is not easy. And I try to make sure that I give my patients every opportunity and every ability to have the most accurate diagnosis possible, so my treatment plan will be as accurate as I can do it.